Welcome to True Health Tuesday, and the truth will set you free. Okay, today, does disease exist? Now, we just finished the last Thursday of every month. We do an apprenticeship program where we talk about anatomy, physiology, neurology, everything. And the first one was anatomy, physiology, neurology. The second one was breathing. The last one we did last week was on kidney, liver, and spleen. No, it was not a dish. Okay, we're talking about functions. I know, my mom used to make it too. Okay, so now I'm looking at, because I asked them during the class, I said, if anyone can come up with an actual disease, okay, something that is not earned or acquired, okay, something that's actually attacking. And it was really interesting because think of this. Now, Majid Nawaz, if you haven't watched, because we can't bring him up during the non-censored version, because he is brilliant, and we got to dumb down the public. So I'd encourage you to watch last week's The High Wire episode, The High Wire. Okay, last week, watch it. It's amazing. So adaptation or disease. So the censored portion is going to be actually on enslavement, and we're going to cover what that is, because that's all I can say, because we would get wiped out. And all those, if you're watching on Dr. B VIP, you're going to watch it uninterrupted. It'll go right through. Stream Health Academy, we're going to be putting all the Dr. B IP stuff on there as well. And you can still get on there for 2 weeks for no charge using Bergman 14. So delusion of diagnosis, when you look at this stuff, most of these conditions are considered idiopathic. We don't know. And so when you go up to the pharmaceutically trained Pez dispenser, which they're talking about how brilliant telemedicine is. I mean, you just get on there, you answer some questions, he's got the drug for you. Okay, it's amazing. Okay, and I know what you're thinking, just one drug for all, right? It makes sense, one shot for all. It's really kind of cool. It just doesn't really work. So when you look at these things, what's the shape of fibromyalgia? Is it actually attacking someone or an adaptation? What animal on the planet can't regulate their own blood pressure? No, humans can regulate their blood pressure, but you're taught that you can't. Okay, in fact, the numbers change all the time. So this is crazy. Like, I just talked to a gal. If you understand that cancers, or the body literally forms tumors. The body forms tumors. The tumors are not formed by aliens. Okay, they're literally a response by the body by environmental toxins. Okay, and I was asking this gal who had breast cancer, 4 stage 4 breast cancer, went through the whole surgery, chemo, radiation, mastectomy, everything else, and it came back. Raise your hand if you've ever heard that before. Yeah, every hand goes up. Yeah, I know. Of course, because it's not lack of chemotherapy that's causing the tumors. All cancers are systemic. They have to do with the entire body. So you have to treat it like it's the entire body. You've got to change the physical, chemical, emotional stress. You got to detox the system. You got to find the poisons. And based on the side of the chest of where it occurs, that gives you a clue to the location of the poisons. This is why 85% of breast cancers are on the left, because that's what goes up there. I mean, lymph drainage for the gut goes to the upper left quadrant. So how many people are taking antibiotics, which damage the gut flora, which increases breast cancer? Look at all the medications, all the toxic foods. Glyphosate, is that carcinogenic? Yeah, okay. So that left upper quadrant, it makes sense. Right one's more for dental and pulmonary toxicity. So when I'm asking her the location of it, she says, no, it's spread through the whole body. And I said, no, dear, it's in the whole body to begin with. It's systemic, all cancers are, but they present locally. So the idea that these are actual entities attacking you, and then you're going to take toxic medications that have a myriad of effects to solve that, that's the medical system we're in. So we're going to look at something a little bit different. Okay, you've got 3 stressors, and your body responds the same to all 3: physical, chemical, and emotional. Now, the pharmaceutically trained Pez dispensers, medical system, okay, they're not trained in critical thinking. They're really good at memorizing and regurgitating. Okay, and you see this because if you ask them a question like, "Gee, doc, what are the side effects of this?" They freak out. It's like, "Oh my God, you can't ask that. Don't even question me." Okay, has this been studied in a placebo-controlled trial? Try that one. Okay, so look at the three stressors, and this is how the body's going to adapt. And the body adapts the same way to an emotional trauma that you would to a physical trauma, and the same way to a chemical trauma. So all of this stuff, you react correctly. So when someone comes in with attention deficit disorder, inflammatory bowel disease, high blood pressure, type 2 diabetes, all of these are stress-related diseases. They're not actual diseases. So the autonomic nervous system, it's in two parts. One part keeps you alive under stress, and that's the sympathetic. The other part regenerates tissue, and that's the parasympathetic, and that's actually located in the neck and the pelvis. So what would happen if you saw somebody that's walking down the street because they have bunion formation or they have flattening of the feet or something? Do you think their pelvis is going to be good or kind of unstable? Probably unstable. And this is why when we do the exams, if somebody is presenting with a chronic stress state, and they'll say, "Nah, it's just my back, doc." And I'll go in, "Okay, we'll take off your shoes." "No, it's not my feet, it's my back." "Okay, I've always had bunions. Flat feet run in my family." Have you ever heard that? Okay, no, flat feet don't run. Okay, so it's an indication of compromised or altered mechanics, and that just makes sense. Now, this is how we actually measure it. This is a heart rate variability. It's been around since the 60s. We got a refined version, but normal has to be in that green zone. The top of the green zone is the best. Sympathetic dominant on the left, parasympathetic dominant on the right. And both are pretty similar because if you're in a low functioning parasympathetic, you're having trouble regenerating tissue. If you're in a stress state like a sympathetic dominant, you're having trouble regenerating tissue. So now think of this. Short-term memory isn't important for your survival. Long-term memory is. So if you're going from trench to trench, or challenging relationship to challenging relationship, or TV program to TV program, okay? And I'm talking commercial TV, not the censored stuff on the free channels. Okay, I'm talking CNN, baby. That's panic to panic. Okay, and that means you're going to have a problem with tissue production. And that's what most of these conditions are, because you're only alive because you're able to assimilate nutrients. You get amino acids from proteins, fatty acids from fats, and usable sugars from carbohydrates. So if you're in a stress state, you're in an imbalance where you can't produce tissue. And so like today, and again, I'm going to bring up a whole bunch of cases. This gal was diagnosed with osteoporosis. Now, when we talk about our bone health and osteoporosis, if you've been in here, you know that the people that made a drug that you have to take, and what it does, you've got cells that live on the bone that build up bone, those are osteoblasts, cells that live on the bone that tear down, there's osteoclasts, and need that build up and tear down to have strong bones. And let me tell you, bones can be really strong. I mean, I literally, you can break concrete and bone and wood with a good solid bone. Okay, I mean, you see it in martial arts all the time. So incredibly flexible. She had osteoporosis. Now, what they did, they developed a drug that stops the osteoblast and osteoclast. It's called a biphosphate drug. So the bones appear denser. However, if you take it for more than 5 years, you have an increased risk of fractures. Hi, I know you're at risk of fracture because you have thinning of the bones. Take this and they'll look damn good for about 4.5 years, but you got to stop it because the fractures will increase. Wow. Okay. And so when I tell this gal, osteoporosis is really an adaptation to acidity. You have respiration, perspiration, pooping, and peeping. That's it. Okay. if you're locked inside, you're not perspiring, you're probably not respirating, you probably got one bowel movement a day, and she's going, oh yeah. Okay, so your blood's acidic. So the body, to alkalinize the blood to maintain the 7.35 to 7.45 pH, it's going to go to the bone bank to withdraw the positive ion, the calcium. So osteoporosis is from acidity, and it's the body doing everything it can to alkalinize. Now, if you break a bone, anyone in here ever broken a bone? Okay, it healed, right? 4 to 6 weeks later. And in fact, if you look at that bone that was busted, it's stronger than all the other bones around. So if broken bones take 4 to 6 weeks, guess how long it takes to fix osteoporosis? About 4 to 6 weeks, but you got to fix the physical, chemical, emotional stress. Okay, it just makes sense. So here's a patient, and this one, I want you to blow this one up because we're looking at before on the left, after on the right. And it's going to be kind of hard to see this from where you're sitting. On the computer, it'll be really, really easy. Patient comes in, and she's from California. Okay, so this is not like a long trip. Now, we've got patients from literally all around the world. So if you're from California and you're 2 hours away, damn, that's like my back door. Okay, you know, if you're 5, 6 hours away, that's still the back door. Okay, so this patient has not been adjusted yet, okay, by our office. She comes in, get the x-rays, everything else. And on the left one, I'm showing disc compression, and where I got the red arrow, that's a normal bone on the left. Now, she comes back and she has numbness and tingling in the foot. Now, numbness and tingling, this, and this is what you learn in doctor school, the 4 things that are from a nerve compression is electrical, burning, sharp, and shooting. Okay? Electrical, burning, sharp, and shooting. Okay, those and numbness and tingling also too. Now, if you have severe blood toxicity, like diabetes, okay, some type of ridiculous blood toxicity, and this gal was obviously not in a blood stress state. Like if she was 400 pounds, had pink skin, you know, modeling, but spongy, she didn't have any of that stuff. So she didn't have any blood issue. And the doctor gives a nerve conduction velocity test. This means you shove a needle or a pad here, shove a needle and pad on the end, lengthways, and you pass a little bit of electricity through and you say, nope, nerve's still good there, miss. So it must be artery, must be arterial, okay? And I'm going, no, dear, you got an artery. What does arteries bring? Blood, good job, good, blood. Okay, so an artery can do 2 things. It can constrict or decrease the blood flow, or it can dilate and increase the blood flow. So just thinking, common sense. You get an artery that's opened up and a boatload of blood's going down there. Will the leg be hot or cold? Hot. Okay, good. You get an artery that's constricting, okay, and will the leg be cold? Numbness and tingling doesn't come in there, does it? Okay. So it's like, dude, okay, why don't you actually look? Because we're talking numbness and tingling is the most common from nerve compression. Would you want to look at where the nerves come out to supply the body? Am I going too fast? No, this is just common sense. It's like so stupid. But now let's look at this. Okay, no adjustments for 3 years. It's hard to tell on the picture on the right. If you're watching this on the computer, you can tell there's a little osteophyte coming from the anterior aspect of the bone that used to be perfect. We're starting to see disc compression. Why? Because there's lack of movement. Let me tell you, discs require movement. They're 70% fluid, and they need that movement for imbibition to get nutrients. Trauma, bam, the disc starts to get compressed, and then the bone starts to change its shape to stabilize this. So this is called degenerative joint disease, degenerative disc disease, and it is correctable, and it's the end result of a trauma. Now, this is in her neck. Could it be contributing to the foot issue? Yeah, but not really. I doubt it. It's going to be one of the contributing factors, putting her in a stressed state, causing her to not produce healthy amounts of amino acids, so her tissue production is going to be low. But will it be a direct nerve compression of that? Probably not. Okay. But we are seeing progression where the bone is changing shape and the disc above it is getting closer, and the disc, the really crappy joint there, is getting even worse. Did she get adjusted when I showed her this? No, she has to get the doctor's opinion. Okay, I feel better. Okay, this is the front view. Okay, we're seeing, again, 3 years ago and now, we're seeing a significant rotation in the top of the thoracic area. That wasn't there 3 years ago. This is the nerve supply to the heart. When we see a rotation like that, that's cardiac arrhythmias, heart palpitation. And I said, wow, you have heart palpitations. Okay. You can fish. Like if you're a chiropractor and you see a rotation in that area, they're going to say, well, only occasionally. It's just, and then it goes away. Okay, good. Yeah. Well, that's the nerve supply to the heart. Do you think, now knowing that all the muscles that support the head stop right there, do you think the forward head carriage and degeneration and altered structure there, because you can see it's getting a bit worse, do you think that might have a contributing factor to her health? Yeah. But the doctors today, okay, and I'm talking the entire medical profession, is not taught that a structural anomaly can negatively affect the organ tissue, unless it's scoliosis and they say you're just going to get crushed and die. Okay, but there's no data to support that. This is the side view, and I'm talking the side view, looking at the low back at these two bones here, okay, and these two bones here. Now, the nerves that come out of this supply the legs, foot. Yes, you're right. Oh my God. Okay, so when we're looking at this, we're seeing, oh my gosh, there's actually a pretty decent space up here, and there's compression there. 3 years ago, there was really bad compression. Now, there's really, really bad compression. So it's not getting better. Can I just get an amen for the frustration that I had on this? Thank you so much, brothers and sisters. Okay, and ladies and gentlemen, I'm going to be saying that using them pronouns. Okay, so when you look at this, there is nerve compression there at the direct thing, and all you got to do, and I didn't put the bending films up here, but there's movement there. We can regenerate the disc. It's correctable. Okay, but no, she has to get the opinion of God knows what. Okay, bioidentical hormones, difficulty in sleeping. Okay, we're seeing that the stress level actually got worse. So, and it's challenging. Okay, but you got to figure that very few doctors today respect that the body is responding correctly based on the stimuli. Okay, chiropractic used to be the #1 drugless profession in the world, but we are being taken over by the pharmaceutical industry. 86% of the schools no longer teach chiropractic, where the body is self-healing and self-regulating. So when we put that there is an innate inborn intelligence in the body, this means if the body is shutting down blood supply to the feet and toes, is that an intelligent response? Yeah, based on the stimulus. Because like if you're sitting on a friggin' iceberg, okay, and your core temperature is going down, the body's going to shut off that to keep the core temperature alive. So you got to look at how the body's responded. So there's an innate inborn intelligence. Now the body is self-healing and self-regulating. Does that mean that every animal on the planet is self-healing and self-regulating? Yeah, if you got an animal that needs resuscitation, it's probably something that used to be a wolf and now looks like a Pomeranian. Now that's called inbreeding, baby. Okay, that doesn't work well. Okay, but when you're looking at humans, we're self-healing and self-regulating. So when you get somebody that is laying down and their sleep patterns are interrupted because they have trouble breathing, do they need a CPAP machine, or is there compression of their cardiac and respiratory center? No, CPAP machine. If they're having enclosure, bronchus not working correctly, okay, and there's excessive mucus, do they need a steroid inhaler, or do they need to find out how their body isn't producing the surfactant? You know what I mean? If somebody has an elevation in blood pressure, how is it checked? What is their blood pressure normally supposed to be? Because I'm telling you, if you have a couple of shots of espresso and you're teaching before some people, it is not 120/80. I'm telling you that right now. Okay? If I'm adjusting 40, 50 people in a couple of hours, okay, yeah, it's going to be a little bit high. And it's supposed to be. Try carrying groceries up a stairs with 120/80 blood pressure. You're going to be passing out. Okay, so the body will regulate itself, just like every animal on the planet. The arrogance and ignorance of the medical profession saying, I know what your body needs. Your body needs this type of cholesterol. Really, doc? Because before you guys invented the statin-lowering drugs, which cause cardiac arrhythmia or heart failure, causes cardiac myopathies, the statin drugs, they cause hardening of the arteries, the statin drugs. Okay, but it is the first drug to cross the $10 billion mark. So it's something that they very popular. Okay. But why was the normal female levels before they passed the medication 250 to 350? And now it's 100 for everyone, no matter what your stress level or hormone level or adaptation. So this is a lie. Now, 97 to 99% of diseases are really intelligent responses. So if you have a fever, okay, what happens with a fever? Do you need to take a Tylenol? The leading cause of liver damage to reduce your fever that depletes glutathione, which protects your brain and your liver. Do you want to take a chemical like that? Or do you want to make sure? Because knowing that a fever is a body's response to environmental stimulus, and for every 1 degree increase in temperature, the speed of the immune system doubles. And its fevers are generally self-limiting at 107, 106 degrees. Okay, so unless you're locked in a car with the windows rolled up in the heat of summer and dehydrating, that's dumb. Okay, so your body is self-regulating. The difference between genetic and genetic expression. What is the common message from medical world today? It runs in your family. It must be genetic. Okay, well, really, for my great-grandpa didn't have it, my great-great-grandpa didn't have it, my great-great-great-grandpa didn't have it, because all my relatives back to the 10,000 generations that led to me were actually healthy, and they survived multiple pandemics and multiple challenges. You guys all won. You're here. You're the end result of thousands of generations of intelligent responses by the environment. So now they're going to say, what's the difference between genetic and genetic expression? Okay, it's not genetic. Okay, you're talking 3% of diseases are genetic. Now, so we have a system that's completely dysfunctional. Okay, the gastroenterologist isn't going to talk to the pulmonologist. None of these guys know anatomy and physiology, but they do know the chemicals designed to give your body to elicit an outcome. Okay, but they're not looking at how to heal it. And if you're curious, look back at some of the discussions. And I'm talking about the last couple of years about things that were censored. Do you realize, okay, just for the heck of it, if you've told your family members that there is a big censorship going on with information, and they said, censorship? Raise your hand. Okay, 1, 2, 3, 4, 5, 6. Okay, good. I know. Okay, people don't know that this stuff is being censored, so it's just mind-blowing. But this system is designed to sell medications. And with nobody talking to each other, there's no solutions. Now, here's a one that actually submitted to corrective care. This means we're creating inflammation. We're seeing loss of curve on the left, nice curve on the right, and that's before and after. And I blew it up so you can actually see that the disc is starting to regenerate. Bone spurs actually go away. It's really cool. This is after, I think, 30 adjustments, which was like, 2 months. Okay, so you look at this, and we're going to create inflammation, not give an Advil, okay, and restore biomechanics and change their sleep patterns and regenerate it. Doesn't that make sense? Here's one. You can see the thoracic area, which had the rotation, worse there, better there. It's like, God, this makes sense. Yeah, we had 6 degree bend on one side, 4 degree bend on the other. you know, little tiny changes like that make a huge difference in cardiac arrhythmias. Now, it's interesting. This is a journal out of the Journal of Hypertension. Adjusting just the top bone in the neck, and this is taking pressure off of just this bone here. It turns out it's as effective, according to the authors, has a 2-drug combination therapy. Now, this brain that's up here has to send signals down through the central nervous system to control and coordinate every function of the body. If that communication is interrupted, the body can't function well. This, just like Dr. Jacobson. I mean, I'm telling you, if you met Dr. Jacobson, who was one of my mentors, we're talking Korean War vet. This guy was tough as nails. If you came in there adjusting with a watch on, I can't repeat what he would say. And I got a filthy mouth. It made me blush. But if you look at this, any interruption of communication from that brain to the body is going to have an alteration in function. Does that make sense? Since the nervous system controls and coordinates every function of the body. Oh, pituitary function? Pituitary function, you got the hypothalamus up here that's got one hand in the nervous system, one in the endocrine system. So any alteration in communication is going to alter that hypothalamus function, and that controls the pituitary. So you're looking at every function. Balance, brain fog, bam, right here. We got alterations in communication to the cerebellum. The cerebellum controls the frontal lobe. What happens in the frontal lobe of the brain? Anxiety, stress, impulse control, schizophrenia, attention deficit disorder. Now, the cerebellum gets its communication from the body in order to have that communication control. You also have the enteric brain, the gut brain that produces the neurotransmitters for that brain. So all a chiropractor does, and this is directly from Dr. Jake, chiropractors don't heal nothing. They remove the interference so the body can heal itself, because the body's self-healing and self-regulated. Got that? I can still hear him. He still scares me. He's been dead 15 years. This guy is amazing. But can you imagine that? Because these guys, we're talking not just old school. My philosophy instructor, his grandma was one of the first female chiropractors. She had the sugar disease. And this 80-year-old guy is telling me about his grandma who took a buggy ride 3 hours away to get to this chiropractor. Don't know what he does, but they heal stuff and fix people. And she had the sugar disease where they were going to amputate her legs. It's called a diabetes, okay? And she said, well, what happens when you cut my legs off? They'd say, well, you're going to die. She said, well, if I'm going to die with my legs. So she takes the buggy ride over, gets adjusted by the guy, rents the room above his shop, and she recovers. She's so happy about recovering, she mortgages the farm and becomes one of the first women chiropractors. And this gal was amazing. She would go into prisons and just address hundreds of guys, okay, in there, all upper cervical. I mean, you could do 100 people in a day by yourself pretty quick. But she felt the only reason that they weren't functioning in society is because, listen to this, the brain to the body connection was altered, that they're in a stressed state. They're not thinking clear. There's not clarity of thought or actions. And she wanted to help them. Okay? That's cool. Okay? So chiropractors don't heal anything. They just remove the interference. Multiple sclerosis and Parkinson's. A study of 44 multiple sclerosis patients and 37 Parkinson's disease patients who received treatment over a 5-year period. 91% of MS showed improvement, 92% of Parkinson's. Now, 5 years. How many adjustments over 5 years? Don't know. We'll do 3 adjustments in a day on acute cases. But you know what's wild is every chiropractor that I know, okay, if they have a family member that's hurt, they'll see him 2, 3, 4, 5 times in a day just to get him working right. You know why most chiropractors don't do that? Because the bureaucrats govern the care. Insurance won't cover it. Is that criminal or criminal? So if you go along, if with injustice is done, there are no innocent bystanders. So we have to correct that. Here we go. Wrist pain. Okay. 2015, we got one x-ray, 2022, the other one. Now she fell, okay, hurt her wrist, and it hurt right here. Now, when you look at this arm, anybody have x-ray vision? Okay, well, I know some doctors do because they'll look at somebody and they'll say, oh, it must be the arthritis. Here's a drug. You know, and I say, did he take any x-rays? No, he just looked at me. And I thought, wow, cool. When I was a teenager, I wanted those glasses too. Okay, so there's two bones here. One holds, one right here, okay, is wide up here. It's called the radius. The other one's a little thin one. Okay, it's called the ulnar. The ulnar is like the hinge. Okay, the radius is for rotating. Okay, it's really simple. So she fell and hurt this. Now, they said that she tore tissue in the middle. Now, has anyone in here ever torn tissue? Duh. Everybody has. You fell off the bike. Okay, you fell off the tree. You fell, you know. Yeah. Did it heal? Yeah. You tear tissue, histamines are released, and the body initiates a healing process. So it's not that it was damaged. Why isn't it healing? Now, let's say, and again, I'm going to dip way into the old common sense thing. You injure this. Now, did you injure it by laying down on a couch, or did you slam it into something? What do you think? Slam, of course. Yeah, it's not that hard. There had to be a trauma to injured tissue. Okay, so bam, you hurt it. It happens to be in between here. Now, do you think hitting it hard like that is going to maybe screw up the elbow, maybe the shoulder, if you're hitting hard enough? Yes or yes? Okay, but no, there's the medical system, so you only look at the side of pain. You don't look at all the common sense stuff that it might be involved in. So we actually looked at the common sense stuff because if you understand, it's not that the damage was there, it's why isn't it healing? Now, if you have a problem in the neck, and just think of this logically, and you have a problem, say the rib cage, since the shoulder has 18 muscles that guide it up and down the rib cage, if there's any structural deviation, do you think that might affect the arm? Yes or yes? Okay, good. Yeah, it's not that hard. Okay, so the impact could be affecting everything. So we take a picture of the neck. We're seeing loss of curve in the neck. So we know that the brachioplexus comes out here, and that's going to alter that. So can tissue heal if you have compromised blood supply and nerve supply to it? Maybe. But if you restore blood supply and nerve supply to it, it will heal better. I know. Isn't this like nuts? Okay, so this is her standing up. A few years ago, we can see in the rib cage area less of a bend. After this, does anyone see the bend in that thoracic area? You in the back, can you see that? Yeah. I know. God. Duh. It's so frustrating. And then when you get somebody that says, well, my doctor will decide. Your doctor doesn't know his and the hole in the ground. Okay, so we're at a system now. Yes, 2 weeks to flatten the curve, but don't mention that. We can't do that because this is the censored portion. Okay, that people might be losing their faith in the medical system. Now, I'm not saying that lightly because it's a religion of medicine. It is faith-based, okay? This drug has a myriad of effects. The ones we want, we call effects. The ones we don't, we call it side effects. But they're all effects, okay? And we're going to give you these chemicals to alter your physiology. Why? Because the doctor's smarter than you. Okay, so we always have belief systems. So if you knew that you could sacrifice a virgin and crops would grow better, okay, and you did that, and you found out that sometimes they didn't, you might lose your faith in that because it's hard on the people and it's hard, it doesn't seem to work right. If you believed in witches, okay, and you decide to sacrifice a couple and all they had to do was drown to prove that they were innocent, and you start to have some people that are questioning that. Let's say that your entire system is made up by the most convicted felons in the world, okay, the ones that are paying the highest fines in the world, the ones that fund the government, that fund the media. And these are the people responsible for giving you the chemicals, so you are now a commodity. You are not, you are the consumer, you're also the product, okay? Because you're what they want to buy and give, okay? So we can call that God, how do they call Satan back in the Bible? Pharmakia. No, let's just call it pharmacy. Okay, so let's call it the pharmakia industry, okay? It's going to take over the entire world by giving you toxic chemicals that have a myriad of effects, and we're going to call it healthcare, okay? And then if you decide that you want to treat your own body, I don't know, it's going to sound crazy, but some people want to treat their own kids. Okay, instead of letting the government take charge of them. But, anyway, that's a different system. Okay, so medications for symptoms. Symptoms aren't there for a reason. Injectables for disease prevention. We're not going to talk about immune system or strengthening or anything like that. And no individuality. One size fits all. Isn't that cool? Or now we have the vitalistic. Now, the vitalistic means that your body is always adapting. So we're going to give supplements, vitamins, exercises. We're going to find out how your body's functioning. We're going to look at the physical, chemical, emotional stress. We're going to take x-rays and nerve scans and everything else to check you. Okay, and actually individualized supportive therapy. So that means that one person might get vitamin C, another person might get glutathione, another person might have a perfect diet that they don't get any supplements, but they sleep like crap. So we're going to change their sleep patterns. Okay, one person might be walking. And to understand, it's got to be individual. I mean, if it wasn't individual, I wouldn't need that friggin' x-ray machine, and I wouldn't need to show the x-rays every time I adjust. Okay, I could just do the same adjustment on everyone. Boy, that'd make it easier for me. Just so you don't think that the wrist shortening, okay, was like it. Oh, and by the way, the first patient, she went to one, and the doctor said, yeah, we're going to cut that bone and shorten the wrist. And she thought, I want a second opinion. The second opinion guy goes in there, no problem, miss. I got this needle. I can shove it right in there and inject some cortisone. And she's thinking, God, I heard that cortisone actually destroys the joint cartilage and weakens the bone, and I don't think I'm suffering cortisone deficiency. So this gal, in her arrogance, being in charge of her own body, decided neither one of those approaches were good. I know! How did you not love somebody that's taking charge of their own health? Okay, so here's a gal, and this happened a few years ago. Same thing. And I'm going, because I've heard this before from like 3 other people. And actually, I was looking for a patient that actually had the bone cut out in their wrist. Okay, and I couldn't remember the name and I couldn't find the x-ray, but I'll try and find it next time. But she had wrist pain. Now, when you look at her neck, that's a reverse curve in the neck. The brachial plexus that supplies it, that's a horrible thing. You can see her upper thoracic area is damaged, but also, does she have high blood pressure? Because the HTN is high blood pressure. She's taking 2 medications for high blood pressure. Anybody thinking here she's got high blood pressure or stress? Yeah, if you're curious about it, I'll just go in there and give you a hell of a whiplash trauma to give you a reverse curve in the neck, and then we'll see what your blood pressure does. Okay, common sense. Thyroid, non-steroidal anti-inflammatories, yeah, that's a genius one. Okay, the non-steroidal anti-inflammatories decrease inflammation, so it damages the joints. It decreases proteoglycan, or the building block of cartilage production. This is a drug that also damages the kidneys and liver, but it has a side effect of making you more comfortable. Feet. Why do we look at feet on everyone? Why? Because feet are cool. Okay, they're supposed to function correctly. If you have a bunion formation, and again, this is huge. We're going to do a whole series on fibroids, uterine fibroids, endometriosis, ovarian cysts. I mean, all this pelvic issues. And why do we ask to look at feet? Because the nerves that supply the feet come out of here, and this holds half of the parasympathetic nervous system. And if your feet are off, do you have a good gait, or do you think you're walking a little bit uncomfortable? Yeah, so 100% of people with bunions have an unstable gait. Okay, and when we talk about gait analysis, so fatigue, slow gastric motility, sleep, anxiety, brain fog. Why? Because they're in a stress state. I mean, doesn't that make sense? So remember, all that altered movement Stimulates that cerebellum. That cerebellum controls the frontal lobe. Frontal lobe is anxiety, stress, depression, and impulse control. This is why we look at the pelvis. How do you measure the pelvis? You go in, because it's generally not the pelvis, okay? It's generally the lumbar. So you take a standing weight-bearing stress x-ray, and you can see if there's abnormal discs. This person ended up having 4 out of the 6 discs in her spine not functioning correctly. And you could call it like slipped or bulging or herniated, but those are completely antiquated terms that shouldn't even be used. They're dysfunctional, because it's not that the disc is the problem, it's the communication with the brain. And the paravertebrals, the muscles that run along either side of the spine, they're not under conscious control. So when you're correcting the disc, you have to correct the brain. One of the ways we do it is correcting the feet. And we'll tell people to walk barefoot in grass or hard sand. Why? Because that's going to work the intrinsic muscles. But before we tell them to do that, we make sure that the tourniquet is off of the foot so they can walk. So we stabilize the pelvis and restore the nerve supply to it. We might even get the calf working correctly. I mean, because the walking is hugely important. Does that make sense? Here's another person that pissed me off. No, this is just cathartic for me. I hope people are appreciating and enjoying this, because, oh my gosh. Okay, so I'm looking at this kid, 23 years old. Okay, when you're 3 times as old, you can say kid. Okay, and reverse curve in her neck. And I'm going, holy moly. Well, there's a massive rotation in the upper thoracic area. Holy moly, that's going to be brachial plexus stuff. 97% of all headaches come from there. I'm seeing a leaky gut. Excessive histamines, like her skin was pink. You go in there and touch it and it turns white. So that's a leaky gut. And she came in for wellness. And I said, look, miss, you got a lot of stuff going on. What did she say? I feel fine. Feel fine. Fine. Nothing wrong. Nothing wrong here. And I said, well, 90% of the nerves that come off the spine, there's no pain fibers. And this is what a normal x-ray looks like, and this is what yours looks like. Remember, we're living in a symptom-oriented society. No one's going to check your body when 90% of the nerves that come off of it, there's no pain fibers. 90%. And if you're curious, just tell me how the left lobe of your liver is working right now. Anybody? Right kidney? Good? Can you tell the difference? No? Anybody got tail end of the pancreas that's not working right now? No. Last part of the jejunum or ileum? No. All this stuff is done automatically. Okay, the bottom lobe of your lung? Do you know what I mean? And so 90% of the nervous system function, 90% of the nerves, there's no pain fibers. To wait for it is crazy. So when I put this up, nerve supply, exercise, nutrition, sufficient rest, and prayer and meditation, that's literally how the body needs to adapt. Okay, does that make sense? Okay, because we're going to get into the censorship part, and this is on enslavement. And so if you're watching this from YouTube and Facebook, God bless you all. If you're watching on the Dr. BVIP, you're going to watch it uninterrupted.